Hello everyone, welcome back to the channel Psych with Obcon. Today's topic is Obsessive Compulsive Disorder, commonly known as OCD. OCD is often misunderstood. Many people think it only means being very clean or organized, but in reality, it is a serious mental health condition that can deeply affect a person's daily life, relationships, and mental peace. In this video, we will discuss what OCD really is, its scientific background, symptoms and types, causes and risk factors, diagnosis, treatment and intervention plans, and how people with OCD can manage their lives effectively. So let's begin. What is OCD? Obsessive Compulsive Disorder is a chronic anxiety-related disorder characterized by obsessions, unwanted, intrusive, repetitive thoughts, urges, or images. Compulsions, repetitive behaviors or mental acts performed to reduce anxiety caused by obsessions. People with OCD usually know their thoughts are irrational, but they feel unable to stop them. Science behind OCD. From a scientific perspective, OCD is linked to brain functioning and neurochemistry. Research shows overactivity in brain areas such as the orbitofrontal cortex, anterior cingulate cortex, and basal ganglia. Imbalance of neurotransmitters, especially serotonin. Difficulty in the brain's ability to filter and stop repetitive thoughts. Symptoms of OCD. 1. Obsessions, thoughts. Common obsessive thoughts include fear of contamination or germs, fear of harming others, religious or moral doubts, unwanted sexual thoughts, need for symmetry or exactness. These thoughts cause intense anxiety or distress. 2. Compulsions, behaviors. To reduce anxiety, individuals perform compulsions such as excessive hand washing or cleaning, checking locks, gas, or appliances repeatedly, counting, repeating words, or praying silently, arranging objects in a specific order. Relief from compulsions is temporary, and the cycle repeats. Types of OCD. Some common types include contamination OCD, fear of dirt, germs. Checking OCD, fear of harm or mistakes. Symmetry and ordering OCD, need for perfection. Intrusive thoughts OCD, disturbing thoughts without visible compulsions. Hoarding-related behaviors, sometimes classified separately. Causes and risk factors. OCD does not have a single cause. Contributing factors include genetics, family history of OCD or anxiety disorders. Brain chemistry imbalance. Childhood trauma or stress. Personality traits like high responsibility or perfectionism. Diagnosis of OCD. OCD is diagnosed by a mental health professional using clinical interviews, DSM-5 criteria, psychological assessments. There is no blood test or brain scan to diagnose OCD. Treatment and intervention plan. 1. Cognitive behavioral therapy, CBT. The most effective therapy for OCD. Exposure and response prevention, ERP. Gradual exposure to fear. Preventing compulsive response. Helps brain learn that anxiety reduces naturally. 2. Medications. Usually SSRIs, selective serotonin reuptake inhibitors, such as fluoxetine, sertraline, fluvoxamine. Medication helps reduce intensity of symptoms. 3. Combined treatment. Best results often come from therapy plus medication. 4. Self-help and lifestyle strategies. Stress management. Mindfulness and relaxation. Regular sleep and exercise. Limiting reassurance seeking. Family education and support. Common myths about OCD. OCD is not just being neat or organized. A habit that can be stopped easily. A sign of weakness. Something to joke about. It is a real mental health disorder. When to seek help. If OCD interferes with daily life, causes distress or depression, takes more than 1 hour a day, affects work, study, or relationships, professional help is strongly recommended. Conclusion. Obsessive compulsive disorder is treatable. With proper therapy, medication, and support, people with OCD can live healthy, productive lives. Awareness reduces stigma, and understanding leads to compassion. If you found this video helpful, please like, share, and subscribe to spread mental health awareness. Thank you for watching.